Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hello, how are you?
Good.
Welcome back to our podcast. So today I want to talk about inflammation. It's become kind of like a bad word in our culture. There's all these like anti-inflammatory diets and anti-inflammatory creams and medications and pills and supplements.
Sure.
But what is inflammation really like?
Yeah.
And what is its purpose in our body?
So it's actually very vital and helpful.
Yeah,
right?
Absolutely. Inflammation is a natural response of your body to harmful stimuli or injury. Harmful stimuli can be anything from a virus to smoking to eating fried foods.
Mm-hmm.
And injury can be, cuts, surgeries, and that's where, we focus on because we do surgery. So we're causing inflammation.
Sure.
There's 5 signs of inflammation.
Mm-hmm.
So it's redness, swelling. Do you remember these?
Yeah, itching.
No, not itching. Redness,
Yeah.
swelling, heat, pain, and loss of function. Itching can be
too.
a byproduct of the swelling.
Right. But
So-
it's also an indicator.
It can
sometimes.
be, yeah. So, and what causes these things? So, and why do we even get inflammation?
Yeah. So it's one of our body's responses, right?
Yeah.
So like you said, when we have an injury or an infection, our body has to be able to fight that, right?
Yeah.
So how does inflammation help our body fight that?
So, inflammation is basically your body bringing in a whole bunch of like helping cells. So, first of all, your blood vessels dilate. So, your blood vessels actually increase in diameter to allow for that extra fluid, which includes like white blood cells, platelets, red blood cells, everything that your body needs to heal itself in that area. And then some of that fluid can actually leak outside of your blood cells, and that can cause the swelling or edema that we associate with inflammation.
Right. So if you twist your ankle and it swells up,
Yeah.
stuff like that.
That's the edema that's caused from all that stuff that your body brings there to help heal that injury that you had. Then also there's heat. So whenever something is inflamed and you touch someone's like arm or whatever, you can feel it's hotter. And that's
Yes.
again a byproduct of all that blood coming to the area to help
Right.
heal it.
And it's useful because usually heat helps
Yes.
to kill infection, right?
Exactly.
That's why we get fevers, for example.
Exactly. Yes.
And that's an indicator that you have some sort of infection,
Yes.
right? But
Heat-
it's your body's way to fight that off.
to kill foreign substances.
Sure.
Yeah, fever is a very good indication that you have some kind of inflammation going on. Blood flow to the area, redness and warmth. And then, what do we do like to prevent inflammation? Because it feels like inflammation is not good, right?
Well, it's often the cause of a lot of the pain that people feel, at least in their mouth,
Yes.
right?
Yes.
So after surgery, like wisdom teeth extraction, especially one that's more invasive, like maybe your wisdom teeth are impacted, and so you have to go in there and maybe remove some bone or something that would cause more injury to
Right.
the tissue. So it causes more swelling and inflammation, and that's what actually causes our pain.
the pain after.
And so maybe that's the stigma about why it's
Yeah.
bad, right?
Yeah. I mean, it's a natural response, but also if it lingers too long, it's bad, right? Like everything else, you need it for a certain amount of time, but then you don't want to be inflamed for, months and years. And that's some of the diseases the inflammatory diseases where that's why inflammation is considered bad. But let's focus on the inflammation that we cause because of surgical trauma or when we do surgery.
So an acute inflammation.
An acute inflammation.
And acute just means it's like short term. So
Yeah.
some of the diseases are chronic inflammatory diseases.
Right.
That means your body is constantly on this alert and
Yes.
constantly inflamed or swollen. And it is a bad thing, but it's more of an indicator of something systemic that's going on or
Yes.
lifestyle habits, right?
Right. Exactly. Like rheumatoid arthritis is a very typical example of inflammation in the joints, which is just constant, and it can be going on for years, and it can get worse, it can get better. There's medication for it, there's treatments for it, but it's something that you're battling all the time. Whereas an inflammation that's caused after surgery is something acute, where yes, you are going to be swollen for a few days, maybe a couple of weeks, but that should eventually subside and you should go back to your normal.
And that doesn't mean there's anything wrong with you. It's actually your body's correct response to what's going on.
Exactly.
Now, when we do surgery, we do give some anti-inflammatories, right?
Yes.
Sometimes steroids even as an injection or pills in
Yes.
order to mitigate that right at the beginning.
Yes.
Right?
And other things you can do is ice it, because again, one of the signs of inflammation is heat. So you're always trying to kind of counteract what your body is doing to decrease the inflammation. So by icing it, you're decreasing the diameter of the blood vessels, you're decreasing the blood flow, and subsequently decreasing that inflammation.
Sure.
So inflammation is just honestly like an amazing response that our body has. And it's considered a very, very innate response, because our body also has responses that are specific to certain viruses. But inflammation is not like that. Inflammation is a general response that we have to anything. And not only us, but most animals have this.
Right.
So it's a very, very ancient biological response. Right. And it has helped us survive and heal for, generations.
It's just like whatever is attacking you, go in there,
go
send
in there,
all the troops
send the troops in. And it's a beautiful harmony of our body that it can coordinate this response, go in there, take care of whatever it is, and then the troops retreat and you go back to normal.
I love it. So,
I love it.
You need to understand your body and why things are happening and be in tune with
Yeah.
it.
Mm-hmm.
So you can take away the fear
Yeah.
of what's
The
happening.
fear of,
Right.
of inflammation.
Because we
Yeah.
get a lot of patients, online who are not our patients, but have gone somewhere and have had extractions, and then they're like, "I'm swollen. What do I do?" And
Yeah.
they're maybe not as informed as they should be about
Right.
what to expect. So can we talk about that for 1 minute?
Sure.
After you have an extraction, especially if it's an invasive one, what should you expect, and what can you do yourself at home to mitigate that?
Okay, so let's talk about specifically in the terms of inflammation. So like we said, your body has to build up this response. So inflammation doesn't happen like that, like flipping a switch. Your body actually builds up these substances, white blood cells, red blood cells, plasma, macrophages, leukocytes, all these cells that have to infiltrate this area and do their work. Well, it can take a couple of days. So typically the highest peak of inflammation, we see it at day 3.
Yes.
And that's when people call us and say, "I'm so swollen," but that's completely normal. On day 3, you're probably the most swollen. And then you're going to start to see things retreat. And depending on the extent of the surgery, of course, it can take a couple of weeks. I mean, it shouldn't be months and years like we talked about with the chronic inflammatory response.
Totally.
Yeah.
But the peak is around day 3, 4. By day 5, 6, you should start to see it kind of come down.
Exactly.
And then by about 2 to 3 weeks, you should be feeling pretty normal.
Yes.
Right? And that's the general inflammatory response that our body has
After a surgery.
after surgery
Right.
in an acute sense. That's really informative, because often people are like, "I was fine for the first couple of days and now it's really bad.
Exactly.
Why?" And
Yes.
they freak out. And it's like, oh, well, that's actually very normal and expected,
Exactly.
right?
Exactly.
So if you're going to ice it, when is the best time to ice it?
So right away, because you want to start kind of decreasing those inflows of cells as soon as possible.
Mm-hmm.
But again, remember, it's a natural thing. You do want some inflammation because that's what's going to help you heal. So actually kind of appreciating it in a way.
And understanding
Yeah.
and accepting. your
Accepting
body's
it and
reaction.
understanding it and letting your body go through its processes of healing and not making it worse by smoking or doing crazy stuff. Like smoking. Please don't smoke. Will actually help a lot.
So that is our story on inflammation. If you have more questions about this, you can visit our website, ladentalclinic.com, and you can book a free consultation so we can talk to you specifically about your needs. you can find that link on our website. See you next time.
Okay, bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.